Normal cells undergo regulated growth, division, and death to maintain tissue health. This process ensures that new cells replace old or damaged ones, contributing to overall tissue integrity. The body employs various signals and checkpoints to control cell growth, division, and program cell death. Cancer cells grow and multiply uncontrollably, disregarding normal regulatory signals. The uncontrolled proliferation of cancer cells results in an excess of cells. Cancer cells ignore signals that would normally halt their growth or trigger cell death. Uncontrolled growth of cancer cells leads to the formation of tumors, which are masses of abnormal cells. Tumors can invade nearby tissues, disrupting the normal function of organs. Cancer cells spread to other parts of the body through the bloodstream or lymphatic system. Normal cells respond to regulatory signals that control their growth and division. Growth signals stimulate normal cells to divide, ensuring tissue maintenance and repair. Inhibitory signals halt cell division in normal cells, preventing excessive proliferation and maintaining tissue homeostasis. Normal cells undergo programmed cell death, apoptosis, when damaged or no longer needed, preventing uncontrolled proliferation. Apoptosis removes potentially harmful cells, maintaining tissue homeostasis. Cancer cells evade apoptosis, leading to prolonged survival and continuous division. Normal cells typically remain confined within their original tissue, respecting tissue boundaries. Cancer cells can invade surrounding tissues and spread through the bloodstream or lymphatic system. Metastasis, the spread of cancer to distant organs, complicates treatment and reduces survival rates. Cancer often presents no obvious symptoms in its early stages. Individuals may not experience pain or notice significant changes until the disease has progressed. This silent progression underscores the need for proactive detection methods. Early cancer detection generally leads to more effective treatment interventions. Early-stage tumors are often smaller and more localized, increasing amenability to treatments. Treatments like surgery, radiation, or chemotherapy have higher success rates when applied to early-stage cancers. Early cancer detection is directly correlated with improved survival rates. Detecting cancer before it spreads significantly increases the likelihood of successful management and recovery. Early treatment enhances the patient's quality of life and overall prognosis. Burning cigarettes release smoke containing over 70 different chemicals. At least 70 of these chemicals are identified carcinogens, directly linked to causing cancer. These chemicals are inhaled directly into the lungs and distributed throughout the body via the bloodstream. Carcinogenic chemicals in cigarette smoke damage cellular DNA. DNA damage weakens the body's ability to repair itself, leading to mutations and uncontrolled cell growth. Increased smoking leads to greater accumulation of DNA damage, increasing the risk of cancer development. Smoking significantly increases the risk of cancers, including those of the mouth, throat, bladder, and pancreas. The risk of cancer extends beyond the lungs to various organs throughout the body. Quitting smoking at any age reduces cancer risks, allowing the body to begin repairing damage. Processed meats like bacon and hot dogs are commonly consumed. These processed meats contain nitrites, which may increase cancer risk. Visual presentation emphasizes the appeal and prevalence of these foods in diets. Cooking meat at high temperatures, especially when burnt, can lead to the formation of heterocyclic amines, HCAs. Polycyclic aromatic hydrocarbons, PAHs, are also formed when meat is cooked at high temperatures. These chemical compounds, HCAs and PAHs, form directly on the surface of the meat during the burning process. HCAs and PAHs can cause cellular damage over time, potentially leading to tumor growth. These compounds interact with cells at a microscopic level, leading to cellular dysfunction and potential cancer development. The process of cell damage and tumor initiation clarifies the causal relationship between these compounds and cancer. Industrial pollution introduces various chemicals into the air and water. Many industrial pollutants are toxic, posing significant environmental and health risks. Key industrial pollutants include heavy metals, particulate matter, and volatile organic compounds. Many household products contain chemicals classified as carcinogens. Exposure to carcinogenic household chemicals occurs through inhalation, skin contact, or ingestion. Prolonged exposure to these chemicals increases the risk of cancer over time. Careful reading of product labels aids in identifying potentially harmful chemicals. Choosing natural or eco-friendly alternatives reduces exposure to carcinogens. Supporting clean air and water initiatives promotes public health and reduces chemical exposure. A DNA double helix model is displayed, visually representing the structure of genetic material. Gene mutations, represented as highlighted areas on the DNA model, can be inherited. Inherited gene mutations, such as those in BRCA and BRCA2, are linked to a small percentage of cancers and elevate cancer risk. A family history of cancer, especially at a young age, may indicate a genetic predisposition. Individuals with multiple family members affected by cancer may have a higher risk. Genetic predisposition increases the likelihood of developing cancer due to inherited genetic mutations. Genetic testing kits enable early screening for potential health risks. Early awareness of genetic predispositions allows for proactive health management. Knowledge of one's genetic makeup empowers individuals to take preventative measures. Fat cells release inflammatory substances, contributing to a pro-tumorigenic environment. Fat cells secrete hormones like estrogen, which can stimulate the growth of cancer cells. Hormonal imbalance and chronic inflammation create conditions conducive to tumor development, particularly in breast, colon, and liver tissues. A sedentary lifestyle slows down the body's metabolic rate. Reduced metabolic rate impairs the body's ability to process energy and eliminate toxins. Metabolic slowdown weakens the immune system, reducing the body's ability to identify and destroy cancerous cells. Engaging in at least 30 minutes of moderate physical activity daily can significantly lower cancer risk. Regular exercise improves metabolism, strengthens the immune system, and helps maintain a healthy weight. Maintaining a healthy weight reduces factors that promote cancer growth. Smoking introduces harmful substances that damage lung tissue over time. Accumulation of tar and chemicals leads to cellular mutations. Cellular mutations can result in the development of cancerous tumors. Environmental risk factors, such as air pollution from vehicle emissions and industrial sources, contribute to lung cancer. Secondhand smoke exposure in public spaces increases the risk of lung cancer, even for non-smokers. Awareness and preventive measures are crucial to mitigate the impact of environmental pollutants on lung health. Early detection of lung cancer significantly improves treatment effectiveness and patient outcomes. Low-dose CT scans are a key tool for identifying lung cancer at an early, treatable stage. CT scans visualize lung abnormalities before severe symptoms manifest, enabling timely medical intervention. Breast cancer significantly impacts the female population, with approximately 1 in 8 women receiving a diagnosis during their lifetime. Early detection of breast cancer is critical for increasing the likelihood of successful treatment and improving survival rates. Understanding the risks and signs associated with breast cancer is paramount for proactive health management. A key warning sign of breast cancer is the presence of a lump in the breast or underarm area. Changes in the shape or size of the breast can also indicate potential issues. Unusual nipple discharge is another important symptom to monitor. Annual mammograms are a vital screening tool for women over 40, capable of detecting small tumors. Mammograms can detect tumors too small to be felt during a self-exam. Although rare, men can also develop breast cancer, emphasizing the importance of awareness across all genders. Liver cancer is a prevalent and deadly disease, especially in Asia. Chronic infections of hepatitis B and C are strongly correlated with the high incidence of liver cancer. Excessive alcohol consumption is another significant risk factor for liver cancer. Unexplained weight loss is a common symptom of liver cancer. Persistent abdominal pain can indicate underlying liver issues, including cancer. Jaundice, characterized by yellowing of the skin and eyes, is a key symptom of liver dysfunction. Vaccination against hepatitis B is a primary defense against liver cancer. For individuals with hepatitis or a family history of liver disease, regular liver checkups are essential for early detection. The liver filters blood, making its health critical to overall well-being. Thus, proactive care is vital. Colorectal cancer originates in the large intestine, also known as the colon. Dietary habits significantly influence the development of colorectal cancer. Diets low in fiber and high in red meat elevate the risk of developing colorectal cancer by promoting abnormal cell growth. Blood in the stool is a key warning sign of colorectal cancer. Changes in bowel habits, such as persistent diarrhea or constipation, can indicate colorectal cancer. Unexplained weight loss is another significant symptom associated with colorectal cancer. Regular screenings, such as colonoscopies, effectively detect colorectal cancer early, even before symptoms manifest. A diet rich in fiber, adequate hydration, and an active lifestyle can significantly reduce the risk of colorectal cancer. Adopting preventive measures promotes a healthy gut and overall well-being, lowering the likelihood of developing colorectal cancer. Thyroid cancer is showing increasing prevalence, particularly among young adults and women. Statistical data indicates a significant rise in diagnosed thyroid cancer cases in recent decades. The demographic distribution reveals a higher incidence rate of thyroid cancer among younger populations and females. Thyroid cancer often presents as a painless lump in the neck region. Tumors can develop within the thyroid gland, disrupting its normal function. Risk factors for thyroid cancer include radiation exposure, family history, and autoimmune diseases. Most thyroid cancers are treatable and slow-growing, resulting in high survival rates. Treatment options for thyroid cancer include surgery and other therapies. Early detection through regular neck checks and awareness of symptoms is crucial for proactive health management. Different cancers present with a wide array of symptoms. Early cancer symptoms are often subtle and easily missed. Recognizing early signs is crucial for timely detection and intervention. Lung cancer symptoms can include a persistent cough or chest pain. Breast cancer may present as a detectable lump or changes in the nipple. Liver cancer symptoms can include jaundice, yellowing of the skin, or unexplained weight loss. Familiarity with one's own body is crucial for promptly recognizing potential warning signs. Early detection dramatically increases the likelihood of successful treatment and improved survival rates. Prompt consultation with a healthcare professional is essential upon noticing any unusual symptoms. A persistent cough lasting more than 3 weeks warrants medical attention. The duration of a cough is a critical factor in determining potential underlying health issues. Prolonged coughing may indicate conditions beyond a common cold, necessitating a medical evaluation. The passage of time is visually represented by a ticking clock, symbolizing the urgency of health concerns. An X-ray image of lungs subtly suggests the possibility of underlying health issues beyond a simple cold. Prompt medical evaluation is crucial to differentiate between a common cold and potentially more serious conditions. Medical consultation with a doctor is a crucial first step for proactive healthcare. Medical scanning provides early detection and intervention opportunities. Regular medical checkups and screenings are essential for maintaining overall health and well-being. Unexplained weight loss is characterized by a significant decrease in body weight occurring unintentionally over a relatively short period. The rapid and unintentional nature of the weight loss is a key indicator of the phenomenon. This phenomenon warrants further investigation to determine the underlying cause. Cancers of the stomach, liver, and pancreas can induce rapid weight loss. These cancers disrupt normal bodily functions, including digestion and nutrient absorption. Metabolic processes are significantly altered by cancers affecting these organs. Unexplained weight loss can be a warning sign indicating underlying health issues. Prompt medical evaluation is crucial to determine the cause of unintentional weight loss. Potential risks associated with unexplained weight loss necessitate timely investigation and intervention. The presence of blood in the toilet bowl after a bowel movement or urination is a critical sign. Any amount of blood detected should not be ignored. The detection of blood warrants immediate medical consultation. Blood in stool or urine can be a symptom of underlying medical conditions. Potential causes of blood in stool include colon cancer, requiring medical evaluation. Similarly, blood in urine may indicate bladder or kidney cancer, necessitating prompt diagnosis. Promptly scheduling a doctor's appointment upon noticing blood in stool or urine is crucial. Early medical tests can significantly improve treatment outcomes and increase the chances of survival. Delaying medical advice can lead to more complex health issues and reduce treatment effectiveness. Breast self-examination involves palpating the entire breast area using specific hand movements to detect any abnormalities. Neck, armpit, and groin self-examinations focus on checking for swollen lymph nodes, which may indicate infection or other health issues. Regular self-examinations are crucial for early detection and improved outcomes in various health conditions. Normal tissue and potentially cancerous lumps exhibit contrasting characteristics. Key characteristics of potentially cancerous lumps include painless growth and unusual firmness. Animation demonstrates the gradual growth of a lump over time, emphasizing the importance of early detection. The message emphasizes the critical importance of timely medical evaluation for any detected lump. Ultrasound examination is a key step in the professional medical evaluation of suspicious lumps. Professional medical evaluation is essential for accurate diagnosis and appropriate treatment planning. Moles can undergo changes in shape, size, or color over time. Gradual changes in a mole's appearance may indicate potential health concerns. Regular monitoring of moles is important for early detection of problematic changes. The ABCDE rule assists in identifying potential melanomas based on visual characteristics. Asymmetry refers to one half of the mole not matching the other half. Border regularity, uneven color distribution, diameter greater than 6 mm, and evolving changes are key indicators. Benign moles typically exhibit symmetry, smooth borders, uniform color, and a small diameter. Melanomas often display asymmetry, irregular borders, uneven color distribution, and a larger diameter. Visual comparison highlights key differences in mole characteristics to aid in early detection. Plant-based foods are important in cancer prevention due to their high nutrient content. Fruits, vegetables, and whole grains provide a high intake of antioxidants. Antioxidants help protect cells from damage, reducing the risk of cancer. Reducing the consumption of processed foods is important for minimizing cancer risk. Red meats are associated with an increased risk of cancer and should be consumed in moderation. Consumption of bacon and ultra-processed foods should be limited to minimize cancer risk. Incorporating a wide range of naturally colorful foods into meals is significant for nutrient diversity. Colorful foods are rich in diverse nutrients that support overall health. A varied, nutrient-rich diet supports overall health and may aid in cancer prevention. Engaging in regular physical activity, such as 30 minutes of daily walking or dancing, can help reduce the risk of cancer. Exercise improves circulation, boosts the immune system, and aids in maintaining a healthy weight, all contributing to cancer prevention. Improved circulation, a boosted immune system, and maintained healthy weight are key factors in cancer prevention. 7 to 8 hours of nightly sleep allows the body to repair and rejuvenate itself. During sleep, the immune system resets and strengthens, enhancing its ability to identify and eliminate cancerous cells. Sufficient sleep is crucial for maintaining optimal health and reducing cancer risk. Chronic stress weakens the body's defenses, increasing susceptibility to illnesses, including cancer. Stress reduction techniques, such as deep breathing or meditation, can strengthen the immune system and lower cancer risk. Reducing stress supports overall well-being and enhances the body's ability to fight disease. The HPV vaccine protects against cancers of the cervix, anus, and throat. The vaccine stimulates the body's immune system to recognize and neutralize the human papillomavirus. By preventing HPV infection, the vaccine prevents cellular changes that can lead to cancer. Hepatitis B vaccination reduces the risk of developing liver cancer. Vaccination prevents chronic hepatitis B infection, a major risk factor for liver cancer. Vaccination helps the body build immunity, preventing long-term viral presence and liver damage. Regular cancer screenings, including pap smears, mammograms, and colonoscopies, are crucial for early detection. Screenings can identify precancerous changes or early-stage cancers, enabling timely intervention. Early detection and treatment significantly improve the chances of successful outcomes in cancer cases. Chemotherapy employs potent drugs designed to eliminate cancer cells throughout the body. These drugs disrupt the rapid division process of cancer cells, leading to their destruction. Chemotherapy's broad impact ensures the destruction of cancer cells throughout the body. Radiation therapy employs high-energy beams to target and destroy tumors. The radiation damages the DNA of cancer cells, preventing their growth and division. This process allows for the localized destruction of cancerous tissue. Immunotherapy enhances the body's natural defenses to fight cancer. It trains the immune system to recognize and attack cancer cells, overcoming their ability to hide. Immune cells actively attack and eliminate cancer cells, illustrating the body's own defense mechanisms in action. Early cancer detection significantly increases the chances of successful treatment. Many cancers are over 90% curable when detected at an early stage. Prompt action and proactive health management are crucial in cancer prevention and treatment. Regular screenings, such as mammograms and colonoscopies, are beneficial for early detection. Early-stage cancer detection significantly improves survival rates compared to late-stage detection. Screening procedures instill confidence through proactive health management and improved outcomes. Self-awareness involves understanding one's body and promptly reporting any changes to a healthcare professional. Individuals with a family history of cancer should undergo earlier and more frequent screenings. Personalized risk assessment and proactive healthcare are crucial components of cancer prevention and early detection. A positive outlook can enhance the effectiveness of the immune system. Immune cells, such as T cells and NK cells, exhibit increased activity when a patient is optimistic. Hope and optimism can physiologically boost the body's natural defenses against cancer. A positive mindset can improve tolerance and management of cancer treatment side effects. Practices such as meditation and support groups can reduce anxiety and discomfort. Improved side effect management leads to better adherence to treatment plans and overall quality of life. Robust support systems, such as family and friends, are crucial for a patient's positive outlook and recovery. Therapy and support groups provide emotional strength and practical assistance, reinforcing the concept that mental well-being is integral to healing. The interconnectedness of support networks highlights their collective role in fostering resilience and aiding recovery.